Hi, I'm Colin Hung with Healthcare IT Today, where we explore the latest technology trends and interesting stories in health IT. On today's episode, we're going to be discussing the operationalizing of new technologies, and we're going to learn a few tips and tricks along the way of how we got patients and clinicians on board with these new workflows and technologies. On the program with me today is Amy Nunez, IT Director, Clinical Applications at Mountain Park Health Center. Amy, welcome to the program.
Thank you, Colin. I appreciate it.
I'm very excited to kind of dive into this with you, but before we go there, can you perhaps share with our audience a little bit of more information about your organization?
Yeah, Mountain Park Health Center is a community health center in Phoenix, Arizona. We have 10 clinics in the Phoenix metro area spanning about 30 miles. We have been serving the community for a little over 40 years. We have everything: primary care, adult medicine, pediatrics, women's health services from an OB/GYN perspective, and I believe we're the only community health center that has a maternal fetal medicine department.
Okay.
Dental, in-house pharmacy, integrated health services, and WIC services, and the first Hispanic biobank. So we're very busy. We serve about 100,000 patients. As of June, we'll be about 1,200 employees strong, and we're doing about a little over 400,000 encounters a year.
This is quite a large FQHC.
Yes, we're busy.
They keep you busy, I'm sure. Now, we were talking off air before we got onto the camera here about all the amazing patient experience projects and work and technologies that you've implemented. We were talking about the texting, the automated messaging, the online appointment booking, you've done, and the patient portal on top of that. What was the driver behind implementing all these technologies? So
we've been what I consider a partnered with eClinicalWorks for the last 12 years. And so we're legacy users. We always try to keep the patient centered in what we do. And over those 12 years, we have been on what I call a patient engagement journey.
Okay.
For 10 years, how are we going to do that? We've tried it all: activities, campaigns, marketing events, etc. And before the pandemic, it wasn't going anywhere. Through the pandemic, we needed to meet the patient where they were.
Okay.
Other industries, retail, without naming actual other brands, they were doing it, and so our patients were also wanting to do it. But we had to take a step back and say, how are we doing that? And so at a recent conference, we heard Deloitte Consulting saying that 87% of Medicaid and Medicare patients have a smartphone. When you're in our clinics, you're in our lobbies, you see them. They're Snapchatting, they're on Instagram, they're on Facebook, etc., you name it. So they're interested. Through some of these efforts, as we were texting, we found that our patients say, we want to text. I don't want to log in somewhere. I just want you to text me, tell me what I need. They want efficiency. That's great, but then when you take a step back, 5% of our staff are early adopters. So that takes a huge load of that. Our experience has also taught us there's a new social determinant of health out there. It's called the digital divide. Who knows how to use the technology, the digital literacy of it, access to that, who uses it and who doesn't. And so the drive behind that was how do we get our patients engaged, but more so, how do we give them what they already want? The interest is there. I think we were kind of late to the party.
So these all sound like fantastic technologies. It's really insightful how you noticed and realized that your patients were using smartphones. How did you get patients on board with using these technologies?
I think through all of our attempts, we look for different ways of how to sell them on an idea, on how to do things. But the feedback, as we were asking, we had navigators out in the clinics speaking with patients. The feedback was, meet me where I am. I don't want to have to go look for information. So I'll use an example of our no-show texting campaign. You miss an appointment at Mountain Park, you automatically get a text message. We've been doing that since, I believe, 2015. More recently, and of those appointments, 40% would rebook. I was like, oh, I missed that appointment. Let me call Mountain Park and get scheduled. We added the link to schedule online, and immediately that 40% went to 61%.
Just by having that one little link.
By having that link right where they were. So that taught us, I don't want to go look for it, make it easy for me. And so we've had to apply our approaches to see, where is the patient? Let's meet them where they are.
Talk to me a little bit about your portal use, because that is a big issue with a lot of organizations where they just can't get patients to log in.
So a couple of things, and I explained that this is a partnership with ECW because there's two factors that happen. Number one, the pandemic, people went online to access information. That happened before the pandemic. I think we were happy for about 8,000 portal users. Currently, we're at about 44,000.
Wow.
We've put a lot of effort to get there, but our EHR, eClinicalWorks, has also supported those efforts because now they've made it easy. It's not as complex to be able to get in. The authentication options that they have that allow, maybe I forgot my username, which is often what we heard. I forgot my password.
Sure.
Now you can authenticate a variety of different ways. If you're on an iPhone, they can authenticate with facial recognition, a PIN, etc. That works, and people responded to that. What we've noticed in the last year is we've been promoting, hey, you don't necessarily need to remember that. We'll authenticate you in a different way. We've doubled our portal numbers. We went from 18,000, to active users. We have 44,000 enrolled, went from 18,000 to 36,000 in 12 months.
Incredible.
Making it easy.
So same question, but now for your clinicians and the administrators, because before you mentioned that only 5% consider themselves early adopters
Correct.
of technologies. So how did you get them on board to using this new tech?
And that's the role that my team, the clinical applications and training team, is dedicated to. We recognize 95% of our staff and clinicians are standing on the sideline saying, I don't know.
Okay.
Tell me a little bit more. And part of that, and how do you operationalize, as you mentioned earlier, the business that we do and the work and the care that we provide. Again, we have to keep in mind our patients are asking for this. They're almost demanding it. Other industries have asked for that. And so what we've done is we've had some creative efforts. We've had a lot of brainstorming sessions with not just us, because from an IT perspective, all of this makes sense.
Right.
But if you're a nurse, a medical assistant, a provider, you're taking care of the patient, this isn't always in the forefront. So how do you shift something that we've been doing for years into embedding technology? And so what we did is we've asked for ideas. If everything were equal, what could we do? And I'll bring up the idea of the QR code.
Okay.
Talk about meeting the patient where they are. One of our medical students brought up the idea of, let's put the QR code on our badge. Let's put a QR code in the exam room. Clinician speaking to the patient says, okay, great, Colin, I want to see you in 3 weeks. I'm going to go get the medical assistant, click on this QR code and schedule your appointment in 3 weeks. MA speaking to the patient, giving the discharge and says, oh, you want to schedule an appointment for the sibling? Click on this QR code. The other thing, as I mentioned earlier, was having that online link to all of our text messaging campaign. Again, meeting the patient where they are is what's been the success, and allowing our staff and our clinicians to see that embedded in their day-to-day workflows has also been the key.
It sounds like the success built upon itself. People saw other people doing it. People saw the reaction from the patients, how easy it was just to scan that QR code to get and book their appointment. And it sounds like that just snowballed and increased.
It snowballed, but in the peer-to-peer learning that happens, what do you mean you don't have to do that? What do you mean all your patients, when they leave, they're done? They're not stopping at the checkout. Well, because they're using the QR code. So the peer-to-peer learning is key. Again, us in IT, it all makes sense. But when you see that aha moment with our staff and our clinicians, when our staff know, oh, I can dedicate to the patient that's right in front of me, rather than dealing with X, Y, and Z, that's where you get engagement for sure.
What was the biggest lesson learned from this journey that you were on and all this implementation? What would you tell our audience as the one thing that they should know?
So from an IT perspective, you're constantly thinking of change management. You go through all this plan, you want to cover everything. And I think what we then tend to lose sight is you can't lead change through technology. You can't use the technology to drive that. What has to be the driver has to be the overall experience from the clinician staff perspective, but most importantly for the patient. We've learned that focusing on the patient and allowing for the patient to be engaged in the clinician, not having to worry about the technology, allows us to improve the quality of care that we provide.
Now, I have to add as well, you're an FQHC. You don't have a lot of resources, so you've had to be very resourceful. I've heard of some very unique things that you have done. In addition to the QR code, you were doing something with candies, is that right?
So, people tend to come around food and be able to bond along food. So part of those engagement efforts, we put little catchphrases on a variety of different treats just to keep people engaged. For example, we had little packages of trail mix, and so we put we go nuts over contactless check-in. Just simple reminders so that people know, enjoy a treat, but also remember the value of contactless check-in.
And I have to say, a healthy treat.
A healthy treat at that, yeah.
It wasn't real candy. It was
No.
It
was a trail mix. There was some protein involved.
Good for you. Amy, you shared so much wonderful information. Where can people go to find more information about your organization?
Absolutely. Again, it's been a journey. We're all learning together. We're happy to help. You can go to mountainparkhealth.org. There's a patient resources section that can kind of tie you into the IT side of the house, but we're happy to help.
Amy, thank you so much for being on our program today.
Thank you.
If you enjoyed this interview as much as I did, we'd love for you to check out other great resources on healthcareittoday.com. I'm Colin Hung. I'll catch you on the next video.